So we're going to end this last session and do some real talk here. So all of you are still in the room, likely because you were the people that are going to make things happen in your organization. However, it may be that we feel like this right about now. There's a whole bunch of stuff floating around in our heads. There's new ideas floating around in our heads. Our stomachs might feel a little bit of this with the prospect of going back to our offices and trying to convince our departments or our fellow employees or our leadership to adopt some of these practices. So this session is really designed to help you think through, before we leave this room, what do we do next and what's our action plan? Now, to be fair, your path is likely not going to look like this, right? There is no silver bullet, as we talked about yesterday. However, what we think we can do with this last session and panelists who are going to give you some stories and some success stories, if you will, is make your journey look a little bit more like this, where at least you'll end up out on the other side. Now, one thing I think is really important about all the things we've learned about, particularly today, is that all the things we've learned about are tools. They are not the end result. And so one of our goals and objectives should be really to identify what are we really looking to accomplish. And let's harken back to that Swiss Army knife that we heard about from IDEO and from Brian Walker. You are now equipped with more than 2, possibly 10 Swiss Army knives. And so your goal and objective should be to figure out which Swiss Army knife do I use to get out of the various predicaments, the various conversations, the various barriers and the challenges that I might encounter by taking some of the learnings I've learned over the last 2 days back to my department, to my colleagues. And so here's some potential opportunities for you. I'd like to just talk a little bit about 5 steps to introducing innovation to your teams. Now, this is not rocket science, and a lot of you are very smart, and you likely already know these things. I just want to provide a sense of clarity and calm for you as you return back to your home base. Step number 1, know what you want to accomplish, and specifically, what is the end game? What is the outcome that you're looking to achieve? So as we were reminded by Julia, the outcome is not, I am going to create a Facebook page, right? The outcome might be, we need to create conversation and dialogue between this specific community. The outcome might be, for the type 1 diabetes example today that we heard, that we want to allow kids to test their own insulin levels so that they can have a more free life. Their parents can have a more free life. That's an outcome. And what we want to do is understand what that outcome looks like, and then which Swiss Army knife, which tool do we have from these past 2 days where we can use to apply to that outcome. Next step, find an internal ally, coach, or partner. This is someone that works with you, that you can work with to identify, here's our outcome, and here's some possibilities of how we can approach getting to that outcome. And this, again, sounds very simple, but you're going to need a partner internally inside of your organization to allow you to move forward, to talk with when you reach a barrier, to figure out how to, once we reach that barrier, do we go up, do we go down, do we go around, do we go to the side? How do we make sure that we push through? Now this is another key that may be not as intuitive, which is find an external ally, coach, or partner. Now a lot of the folks that you learned from today were from external organizations. They are all here, and they all have opportunities to help you. From Facebook, from Google, from Quantified Self. There are people out there that want nothing more to apply what they know from technology, or what they know from social enterprise, or what they know from their experience to helping someone like you achieve your desired outcomes, and more specifically, to help improve the quality of health in their communities. If you don't reach out and find someone to help you externally, who can give you the knowledge that you may not have, it's going to be just a lot harder, right? And one of the things that I heard from all the technology folks, the speakers over the last 2 days, is they know their model. They know their world. They oftentimes know the public health world too, but they recognize that the public health community knows so much more. And all they want is to be that bridge and to provide that opportunity to have that conversation. They want to hear from you at the same time you want to hear from them. So feel comfortable reaching out to someone for help. They're willing to help you. And then once you have an internal and an external partner, pitch your idea and your desired outcome together, right? Now, pitching that idea might be to your internal leadership. It might be to a city council. It might be to a funder or a grant maker. But make sure that you have some support, both internally and externally, to help you show what the outcome can look like. Because that outcome is going to be what people buy into. They're not going to buy into the tool. They're not going to buy into the Facebook page. They're not going to buy into open data. They're not going to buy into an app. They're going to buy into the outcome that you're looking to accomplish. And that's really important. And last but not least, listen to each other's perspectives and find the path forward. And so what I mean by this is just this. It may not ultimately look like what you think it's going to look like at the end of the day. So you might have that desired outcome. I'm trying to create conversations among HIV community members so that they go get tested. Well, you might have a specific point of view around what that looks like, but after you do steps 2 through 4, that path might change a little bit. It might actually get better. The tool might change. The scope might change. And it's okay. That's something that we should be comfortable with. It may not look exactly like what we thought it would at the end, is what it looked like in the beginning in our mind. And that's important because you're going to learn from each other's perspectives, and you're going to get there, you're going to get a different outcome, but one that may, in fact, again, be better. And here's a visual to kind of show you what I mean. What's going to happen is you're going to start out thinking you're running a race, right? And it doesn't matter how you get there, but you do need to continue moving forward. You're going to change form, but just push forward. And I want to bring up now 4 trailblazers who've done this, people who are in the government sector, who have sat in your seats and made this happen. And they're going to give you some stories about what they overcame, the challenges that they overcame to implement new and innovative technologies. So let me introduce Stacey Palosky, the Digital Director for Campaigns at the Center for Tobacco Products and the FDA. And Jill Roark, Health Communications Specialist Lead, Adolescent Immunization Communication at the CDC in Atlanta. SaraT Meyer, the Senior Director of Healthy Communities at Code for America. And last but not least, Margi Bradford, Active Transportation Division Manager at the Portland Bureau of Transportation. And so without further ado, I'm going to let each of them tell you a little bit about their story, and then we'll have a discussion. Stacey, you're up.
Hi, everyone. Welcome to the end of the day. So we get a really bad rap in government that we're a no-tech zone, right? We have lawyers who are fighting us, saying, no, that's too risky. What are you thinking? But yes, we can get through the lawyers, and we can get things done. And it's something that we've done at FDA very successfully. So Kathy Crosby talked earlier about the real cost and showed you a bunch of the campaign and some of the successes of the campaign. This is just a sampling of our social posts on the campaign. As you heard earlier from Danielle about Tumblr, we've had huge, huge successes on Tumblr. You can see in, one of the GIFs there, but teens really love plays on their cell phones and pets. I can tell you that. On the right-hand side, on the other side, you can see a bunch of Instagram posts. We've done a lot of research about how kids use different social platforms, and they definitely use them very differently. In Tumblr, they're girls, they're emo, that's their locker room wall. In Instagram, they are heavy, heavy emoji and very much self-validation. So we take that knowledge, and that's what our content is. So we have decks, like huge PowerPoint decks, and they go through clearance, and they're making adults' eyes spin because of all of the movement. And we're like, yeah, but that's what the teens like. And okay, go for it, and that's what we do. So in addition to all of our social platforms, and you've heard a lot about social platforms all day today, the top image there is a game that we did. It's a digital banner ad, a 2-shooter game. Shoot cigarettes, teeth, out they go. There you go. And it had amazing, like 24-26% click-through rate because kids play. And so we actually, because of the success of that, decided to take the time to turn that game into a 508 compliant website game that is now on the realcost.gov. The bottom is actually just a play on our bully campaign, which is also, it has really large numbers of YouTube views, and they really just like the movement. So I know that some folks have talked about some user-generated content. We've done that on our Tumblr, where we have a Reasons Not to Smoke campaign, and we encouraged kids to give us their wacky reasons not to smoke. There's one of them, and we had a whole bunch come in. We had a Fingers ad with alternative music go viral in the heavy metal community of teens. So they really do just like, as long as you're living in their space, communicating with them the way they communicate, they really will come, and you can sell leadership on that. Fresh Empire is a different style of a campaign. It's a lifestyle campaign, and we use a lot of events in there. So we actually are combining a personal touch with real people at real events, taking photos at those events, posting them on Facebook, and the kids are Instagramming them. So we're combining channels. They're using their channels in the ways that they use them very differently, and it all works. It's been really successful. On the right is, it's an example of a simple social post. You can see there's no imagery in there, but yet they're commenting on it, they like it. We have a bunch of really good images, but we just have some text-based stuff too you can really do pretty easily. So what are some lessons we've learned from teens and in this space? Teens are snarkastic, okay? They're snarky and they are sarcastic, and they combine it all. And they're different on their platforms. So on Facebook, their parents are watching and they know it. And we have amazing long conversations with teens on Facebook. It's our most talk back and forth channel. On Instagram, their parents are not watching. They have a different personality. And they will really come out and say some crazy, wacky things on Instagram. When we do talk with them, which we do all the time, we have moderation 9 a.m., 9 p.m. We have a whole extensive response bank. We talk to them, not everything, selectively, and they respond with, oh my God, thank you. Like, I didn't think a real person was gonna talk to me. And as soon as you have that conversation with them, they start fighting for you as a brand. They're coming in as our ambassadors. They are talking with people who are against us. They will say, no, this fact over here. They absorb it really, really well. And then they're fickle. And so because they're moving around platforms, we have to move around platforms. They get their media from different sites. We have to go to those sites. They're on Snapchat. How are we going on Snapchat? It's just the world we live in today. So how do you actually get that done? I have 5 things that I keep in my head and keep moving all the time. Number 1, your leaders need to support what you're trying to do. Because if they don't get it, they're not going to fund you. They're not going to be with you when you have your bumps in the road, and you will have your bumps in the road. Failing is a good thing. You learn from your failures. So they need to really buy in that this is what we have to do to ultimately change behavior. This is what we have to do to reach these audiences. Lawyers, talked about them early on. You want to butt heads with them sometimes, you want to shake them sometimes, but you have to make them your friends. You have to make sure that they are hand in hand with you, having your back, so that they're comfortable, everyone's comfortable. Transparency, things are gonna go wrong. They always, always do. And you roll with it. You are open about it, and you say, here's how we're gonna do it. We have, to be frank, 115-page PowerPoint slide deck that is our standard operating procedure for our social media platforms. Trust me, lawyers get their say, but they trust us to do our job because we've given them all of this open stuff, and that's really our risk mitigation strategy. We have these procedures, we have response banks, we have expedited clearance, we have everything in place to be able to handle any situation. And we've had plenty of those situations come up, and none of them has been a showstopper. Everyone's like, okay, how are we handling it? Oh, okay, great. And that's really what you want. And then resources. enough can't be said. Everyone doesn't want to fund digital. They think, oh, because it's online, you can do it really cheap. And so one of the things that you have to sell leadership on is, no. Just like a print material takes effort, just like television ads take effort, we really need to resource it properly, to do a good job, to have that two-way conversation, to not just throw something up there and hope, because there's too much clutter out there to be hopeful that it's going to work. You have to really be having a full engagement opportunity. Thank you.
You're so close to the end of the day. How many people are excited about leaving the basement? I know I am. All right, so I work at CDC, and I work on adolescent immunization communication, which is a relatively new thing because the vaccines for adolescents have only been out for about 10 years. And so most parents today who were vaccinated know they got vaccines. They don't really remember it because they were babies, because we only had infant vaccines until 10 years ago, besides flu and travel, but most people aren't getting those. So what happened was we needed to start all over in terms of how we talk about adolescent vaccines, because it's completely different. And most parents are going to the doctor and they walk in, their child's 11, and the doctor starts talking about vaccines, and they're like, what are you talking about? Because they're completely surprised. Because frankly, I don't know if you've heard, but clinicians are not the best communicators, and they're not exactly sending out memos. Oh, and by the way, before you get here, I want you to know we're going to be giving your kids some shots when they come in. So 3 vaccines that are regularly recommended for 11 to 12-year-olds, which is what this very easy to read chart is here. I kid you not, this is our easy to read version. You don't even, I couldn't even put the other one up there. It's like 4-point font. So out of all 3 of those vaccines, we have one that's a little bit of a stickler, and I'm sure you've heard about it. It's the HPV vaccine. And when we do things like focus group testing and we talk to parents, we always ask them when they say, well, I'll get the other vaccines for my kid, but not that HPV vaccine. Well, why? And I kid you not, we actually had a woman in a focus group do this. Well, it's because it's about down there. And they don't want to talk about it, right? So here's this thing that they don't want to talk about. They're going to pediatricians who became pediatricians so they never have to talk about sex. And guess what? We actually don't want them to talk about sex either. Now, here's the background. I used to work at Planned Parenthood. I could talk about sex all day long. I have no problem with it. But in terms of HPV vaccine, we actually don't want them talking about sex. We want them talking about cancer, because that's what it prevents. And so a few years into the campaign, we were in a situation where we didn't have very much money. We had very little resources for adolescent immunization, because let's be honest, the babies get everything. They're cute, everybody loves them, they've got the little wrist wrinkle, and it's not like preteens exactly evoke all the feels. So it can be really difficult to say, hey, remember those 11 and 12-year-olds that you kind of wish were staying at somebody else's house? We have to remember to tell parents they need to be vaccinated. And so we had very little money. What do? We had not done anything digital. And so we really kind of stepped into digital. And the reason why I'm using this, out of all the things in our campaign as an example, is because it's a really easy way to start. We had nearly nothing. So I actually did a presentation on what I'm going to tell you about, and it was basically how to do this on a shoestring budget, because it's all we had. So what I really like about this picture that I stole is that out of the 4 circles, only one of them actually says paid. So there are things that you can do, as we've all talked about, that aren't necessarily going to take a ton of resources, might take some, and a lot of in-house resources. So we really relied on our staff to do a lot of work. So this very first project that we did, 2 main elements, when there was actually a lot more that involved things like earned media, but the 2 things I want to tell you about had to do with engaging groups that currently existed in the social media world. One is Twitter moms. They're now called social moms, and these are moms who have blogs, and then they also tweet. Seems like a pretty basic thing, because a lot of moms who have blogs would also tweet, or today they'd also be on Instagram and other things. But what's neat about it is that this sort of collective of moms, when they sign up, put in a lot of information about themselves and what they're interested in. And so what we were able to do was work with social moms or Twitter moms back then, to find 68 moms that were willing to receive information about preteens I mean, there's a lot of these moms, and only 60 of them were like, yeah, sure, let's talk about preteens. And health, both of those things together. And so what we did is we sent them a letter, and we said, you know, adolescent immunization is a really big deal, and we're not seeing enough kids getting vaccinated. Here's why it's important. Love CDC. And we'll get into some of the details about how that could have been a little sticky. The other thing we did is this group, Momversation. It's a momversation.com website, little news articles, not very long. And they offer us an opportunity, so it was sort of earned media placement. We could put an article about HPV vaccine on there. So this is where I come to champions, because again, childhood immunization has been around for a long time, and so they do things kind of traditionally in those campaigns. And we're this like brand new, upstart preteen vaccines. We're talking about moms that are a little, you know, frankly, they have time because they're not changing diapers. And so we're going to reach out to them in a little bit of a different way, and we needed some champions. I highly recommend women who are powerful and wear uniforms to work. They are great champions. No, it just so happens that 3 of our champions, so one is a center director, one was our deputy center director, who is now a division director, and the person that I spend probably like 2/3 of my time with, and then another person who's actually a pediatrician and a mom who works at CDC, so great perspective. So have a champion or 2 or 3, I think is really important, and I love the internal external because it really works. We had an external champion. We were sort of paying her company, but not really very much money because we didn't have very much money, but that helped as well. Now, as we went into this working with Twitter moms, of course, legal got involved because, you know, we had to. And I wasn't ever sure if they really meant this or if they were just like seeing if they could kind of like trip us up. But they were like, so what's their escalation policy? Now, this is not going to be on a CDC website. We are sending information for somebody else to blog about, and they want to know what social mom, Twitter mom's escalation policy is going to be if some anti-vaccine person starts, you know, like having a conversation with this other mother. Well, we said they use the Air Force escalation policy. See what I did there? I flew that in. Because I'm into tech, you know. So it was amazing. Apparently, like if you're in the government and you need something on your side, go with whatever DOD has done. They were like, oh, absolutely, sure. So that worked really well for us. But essentially, prepare for all your contingencies. I mean, think about like how are the 97 ways this could go wrong, because some of those are going to happen. And so that was one of the things. Know exactly what they're going to do if this becomes a big firestorm, because certainly we didn't want to put CDC's name out there in the wrong way. All right, so one of our other huge lessons, and I can't stress this enough, and I love the massive PowerPoint of the protocol because that is so important. And we actually have the way that we work today is because of how we did this project. So we actually, with the momversation.com, they gave us the opportunity and they said, oh, by the way, we need this in 3 days, and it was over 4th of July weekend. But we had luckily had some of our champions who were willing to be on call for clearance and got it cleared literally in 1 day. And if you work for the federal government, you can know how amazing that is. And got it up, and it was incredible. I mean, I still can't believe we did it. Pre-clearance, having lots of things already cleared, ready to go so they could just be put out there. And then the pièce de résistance is our 37-page cleared content document that 4 different centers at CDC came together in a room and agreed on every single word in the entire document so that we don't have to send things for clearance anymore. All right, and you are next.
Excellent, fantastic. Hi, everybody. I'm really impressed that this is a full room at the total end of the conference here, so kudos to all the conference planners. Full disclosure, I don't work in government as of 3 months ago. But I do have about a decade experience in local government. I've now gone over to the nonprofit technology development side of things. So in all this conversation about find a champion, I'm your champion outside of your organization. So happy to give you my contact information and make that possible. You do need an external champion. So I work at an organization called Code for America, and we're really about promoting the practices of 21st century government. And I think it's pretty clear to everybody who's here today, or you wouldn't be here. But today, in the 21st century government really has to be about developing our services and our processes in tandem with developing technology. So gone are the days when you could create a program, you could identify an outcome, and then you could just bring technology in at the end, right? And say, okay, now how are we going to apply technology to this? It really doesn't work that way anymore. We really have to think about how technology is an integral part of everything that we're doing. And it's really what this conference has most been about. So what is our approach? I want to offer you kind of 5 approaches that we take. Lessons learned from working with governments all over the United States. Feel free to steal, adapt, or take any of these for your own purposes. But our first principle is really that all new technology should be built in the open. What this means is kind of open source in technology speak. But the benefit of this is that when you're a government and you're building something that is really for your residents or for the public good, that should be available to other governments to take forward as well. So if you build in the open, if you build with open source, it means everything that you build can be replicated in other places. We think about this as how we're building a movement. We can try something in one place, and then we can redeploy it in another place for a fraction of the cost with similar impacts. The second principle is really to think about user-centered design. So I understand in a health conference it's kind of comical to talk about users. There have probably been many sessions where that was a different conversation. In technology speak, users are really the people who are going to be using the technology that we developed, right? So if you're on Facebook, you are the user in the moment that you are using Facebook. If you are going to be using an application at your desk to do a business process, you are the user in the moment when you are engaging with that technology at your desk. Usually in the health world, this means that we are trying to identify with clients, consumers, patients, but anybody whose activity or behavior we are trying to change. And they are at the center of what we are developing. So we need to understand how they think, how they can use technology, and how we can structure that technology to get the behavior that we want. Third, everything should be developed from a data-driven perspective. We've heard a lot today about how we can now collect data from a lot of people. We can crowdsource data from a lot of people. We can get that in real time. We can get it over a long period of time. We can look at it based on different demographics. And we can use that data, and we should be using that data to always make the technology better. Try to get the outcomes that we want quicker and faster. And so that data really should be a feedback loop back to the people who developed that and are using it to make sure that it improves over time. Fourth, all of the technology should be developed with the community. So while we build something that can be redeployed in many different places, we have to understand the local context and make sure it applies really appropriately there. And lastly, it's this idea of always testing and always learning. So how many people here have bought a big IT system, maybe in local government? You did your requirements, and then the thing got built. You probably spent some money in there, and then it showed up, and you were kind of disappointed. Only a few people. Wow, maybe the world's changed. All right, well, that was something quite frequently that I experienced in local government. And so this is the idea that we can build in little bits, and we can change those little bits over time so that we're not disappointed at the end. So I'm going to just go through one quick case study to just kind of show you how these principles are applied in a real context in a world that you might live in. So I picked CalFresh. This is the SNAP program or food stamp program called nationally. And I picked it because I just spent the past 2 days in a village talking about the prevention of obesity. And obviously, the SNAP program is our federal government's largest investment in trying to make healthy eating more accessible to more people. So we have created an application here in California. We've done it with 5 local governments and are now deploying it in more places. That basically replaces an outreach worker who might help an individual complete an application for CalFresh, or a system that people can access on a desktop right now and complete that takes about 45 minutes or more, depending on how facile they feel with that application. And the kind of novelty or the exciting thing about this application is that, first of all, it uses technology that can be accessed on a smartphone. So many people don't have access to a desktop, particularly if they're in the SNAP-eligible population, but most people have access to a smartphone. Even more people have access to texting technology. So you can complete the application in less than 10 minutes. And then if you hit troubles along the way or your application doesn't advance, we have a team of people that answer instant chats. You might be familiar if you're buying something online, you can usually chat and ask questions. You can do that right with the SNAP application. They do actual follow-up. And if we get asked a question that we don't know, we actually interface with the local county and try and get an answer and figure that out for them. So again, available on the smartphone, takes just 10 minutes. Open source, can be deployed in a lot of different places. So we have 5 counties here in California that are really leading the way. And I want to emphasize that the development of new technology really, again, needs to be in tandem with government services. So that partnership with technology and government is really, really critical. We didn't go out and develop something on the side and then go to government and say, hey, do you want to buy our product? Instead, we worked with the governments to identify what were their problems, what were the things they were trying to solve, and how could we bring technology as a tool to those problems and work with them and build their capacity to implement that technology. So I wish I could say it was without challenges, but we've overcome a few, and I was asked specifically to highlight some of those so that when you hit those bumps in the road, perhaps you'll hear, oh, somebody else had that challenge, but they got over it, and you'll feel excited to get over it as well. So the first challenge is that it's really, really hard to get the full visibility into end-to-end service delivery, right? It's kind of like the quintessential elephant where everybody knows their piece of it, but actually sitting down and thinking about how it all fits together can be a real challenge. Once you have a piece of technology that gives you data on every piece of that spectrum, you get that visibility. But building something without that visibility can be really challenging. It requires really sitting with people who are doing the work, maybe in a paper process today, or maybe in another system, and actually kind of learning how that work is done, learning the workarounds that they've developed to do it better, to help develop the technology that can meet their need. Also, there's always a variety of different players. We think of local government as our primary partner. We always engage in a MOU or a contract with a local government partner, but inevitably, there are a whole host of other people who care about the issue, who want some say in it, who may be using the system. And so thinking about that first and foremost and creating a really big tent for everybody is really critical. And then lastly, oftentimes we're starting with very few data points. While we're confident that we will be collecting a lot of data with the use of technology, sometimes it's not there from the onset. So lastly, I want to just identify for you 3 ways in which you are, or which I invite you to join our movement. We're all in the same movement already, but where you could partner with Code for America to advance that. Our 2017 fellowship will be launching shortly. It's a way where we can bring technology talent into your organization and help advance this work. We have a community of practice, which is a way in which we can support you in bringing technology into your organization, meet you where you are, and then help you move forward. And then lastly, all of you live and work in cities where we have local brigade members, which are volunteer developers, people who know how to code and use technology, and they're just eager to connect with their local government and help you solve problems, and we can make that happen. So thank you.
Great. Hi. I'm the last speaker, so I'm going to try to keep it high energy, and I'm really impressed you guys kept it this long, or kept with us this long. So I'm going to spend a little bit of my time talking about why someone in transportation is at a health and technology conference. And I'm going to use some words, and I might try to teach you a few words to try to bridge the gap between transportation agency and health agencies. How many here work with their transportation agency? A few. Okay, good. All right, next time I come to this conference, I want to see more hands up. So I'll talk a little bit about what I do. So I'm the division manager, which means I oversee basically everything related to biking, walking, and transit, including our Safe Routes to School program, as well as our safety division. So our mission's pretty clear. These are performance measures that I am responsible for and report annually to my city council in terms of moving the bar on. I will say that transportation professionals don't often think of awareness or cultural awareness, so I'm learning all sorts of words. We're engineers, engineer-based, so we're very hard and fast. So why does the city of Portland want to get more people walking, biking, and transit? Why do they have a particular focus on children? Well, I think a lot of you are familiar with some of the city of Portland's goals. It's to improve the health of our citizens. It's to reduce greenhouse gases, reduce air toxics, all those things that I think a lot of health professionals care about. There's another thing we care about. This is a quote from my dear friend and mentor, U.S. Representative Earl Blumenauer, who said, on the floor of Congress, let's have a moment of silence for all those Americans stuck in traffic on their way to the gym to ride a stationary bicycle. Right? Because Earl gets it. Earl rides his bike every day to Congress. He was actually, and just to make sure, everybody thinks of Portlanders as kind of these left-wing nuts. We can be sometime, but he was just voted by the Republicans as the most effective Democratic legislature, which is an honor. So he's saying here, what is this? We're talking about health, but we're not talking about how people travel, and that's the easiest, most convenient way to be healthy. So if you are one of those people that didn't raise your hand, I'm going to teach you a new word, and memorize this word. It's called transportation demand management. Isn't that a terrible, wonky word, transportation demand management? And it's what transportation professionals call behavior change by doing encouragement, incentives, disincentives. And I'll tell you why. Because if you work in especially a more, not as a progressive city as Portland, but say you're talking to the deputy director of highways. Usually their name's Bob or Bill. Well, seriously, ours is Bob. So you say, Bob, I want to talk to you about obesity. He's like, whoa, not my bag, right? That's your Department of Health. If you say, Bob, I want to talk to you about social change. He's like, whoa, we don't do social engineering. I just follow the highway guide, right? But if you say, Bob, I want to take some of the trips off of your highway and I want to help you to manage the transportation system, he's like, oh, come on in, Sue. This is good, right? Because the DOTs, their primary goal is to get the local trips, those short trips, off of the highway, off the main arterials, and get those walking and biking to free those up for freight and throughput. So that said, I have 9 transportation demand management professionals in my group, and that's what we do day in and day out, is we try to get people to change their behavior. So far, it's going pretty good. Portland is the leader in biking, and most of if you read the research around biking in cities, really 8% is thought of the threshold in which biking is really seen as a transportation mode. And we're so very close to that, and we're really excited. We look to Copenhagen, we go there often, they're a sister cities of ours, and me, my staff, my director, we are committed to continue to get that number higher. So we also have the most successful Safe Routes to School program in the nation. We hit a benchmark last year where we had more kids biking and walking to school than any other mode. You can see the blue line there is biking, walking, rolling, and right underneath that is the kids being dropped off. On top of that, we're constantly evaluating Safe Routes to School quarterly, and our most recent data shows that we've got 76.5% of kids who live a quarter mile of school coming to school. So I got to keep going. So in the center of Portland, we have a lot of people biking. The darker the red here, the more people. We have census blocks where 25% of people are biking to work every day. That's 1/4 of people get up in the morning, brush their teeth, and jump on a bike. That's good, right? But look at all the non-red areas. That's our underserved communities for the most part, and our rich communities. So that's our 1% and our 99%. So we have to change how we're doing business, right? We've got Portlandia, right? That's our choir. Fred honestly lives down the street from me, and where they put a bird on it is my corner store. So Carrie and Fred are in my corner, right? But we need to up our game in reaching small kids in underserved communities. So how are we going to get there? First, it is basic knowledge now in the transportation community, this analysis of interested but concerned. It's been tested over and over again. Transportation professionals know that there are the hardcore cyclist, and there's the no way, I will never ride a bike, and then there's this huge area of interested but concerned. That's our target. I gotta keep going. So how do we do that? We do a bunch of small little things that add up to what most people call placemaking and safety, right? We do the safe crossings, we do the bike racks, we do the street seats. We have an open streets program with 130,000 people participating every summer. We are in 100 schools, and we have 375 miles of bike lanes in Portland. So what does this relate to this conversation? What role does technology play in transportation, active transportation? Well, you can get basic travel and safety information. You can collect data, or you can do messaging and behavior change. So I thought about this, and I thought, well, let's start with the data piece. I'll contact Strava. Oops, sorry, I'm going to go to Strava. So you heard Ernesto this morning talk about that Strava deal with the Oregon Department of Transportation. Well, that was my baby. I called him up and I said, hi, my name's Margi Bradway. I work for the government and I want to buy your data. And they were like, ha, nice talking to you, hung up the phone. So I called my friend at Trek, and I called my friend at Rafa, and I said, come on, guys, can you help me get in the door? So my friend at Trek called them back and said, she's cool, dude, just talk to her. Really, this is how this happened. And I had to go on a bike ride and like show myself that I was cool, and anyway. That launched Portland Metro, my phone call. So they brought in $18.5 million of venture capital and went from a staff of 16 to 100 within 2 years because so many cities bought their data. And I'm a government employee, so I can't even accept gifts for everything. Bummer. I know, right? So why do I want this drop of data? Because I want to see where bikes are going in my town, right? I want to see it. So you heard about this. But is this our target audience, right? No. So it gave us a snapshot, and we did a bunch of bias testing. I'm really running into my time here, so I'm going to try to go fast.
Go for it.
Okay, I'm into it. So I said, well, I'm gonna contact the local university, and I'm gonna see if they can help me develop an app that users will use. And oh, by the way, Strava has 2 million users and 1 million trips in Oregon alone. So anyway, I did this research with PSU and others and developed an app that everybody could use that was marketed towards the average Portlander who wanted travel information. Well, guess what? Universities are horrible at marketing. We had 300,000 people and half the trips, and they didn't have a social marketing plan, and they didn't do the focus group stuff. And I should have known, but I learned the hard way, right? So this thing's out there. We're not sure quite what to do with it. So next year, which is just recently, I said, well, what if we had an app that wasn't about necessarily you had to sign up, but could ding everybody's phone? And my friend in the industry put me in contact with William Henderson, who has the Knock app. It's one of the best apps in the country. And he came up with this Bluetooth technology that we're piloting this summer that we're putting in all of our roads so that when people pass by, they'll be dinged and we can tell where they are without them even knowing. So we're getting there. And I'm just going to say, what I had to do, though, I'm going to skip ahead. I'm going to talk about this real quick because it's important. But for all of these things, I had to fight bureaucracy. Like, we have the same bureaucratic problems. I just happen to have a background as a lawyer. So when the lawyers told me no, I said, I know. This is legal. So the lawyers hate me because I'm a lawyer and they know I worked for a big law firm, so they can't anyway. So that was something that was just got past it because I was a lawyer. And but once I started to reach out to Strava, once I started to put the right app on the market, all of a sudden companies start to notice, right? So when we decided to launch, when we will be launching smart bag technology in Portland, Nike came on board as the biggest sponsor ever of Bike Share, $10 million contract that we signed at 4 p.m. on December 24th. And why? And why? Because we are a forward-thinking, progressive government agency, and they wanted to be a part of what it is. So what we're doing. So this is the future, a multimodal integrated app with all the transportation modes. And I'm finishing up here. We're fighting off people who want to work with us right now. We've got Xerox at the table, we've got Intel at the table, we've got GM, we've got Ford. We can't work with either of those because they're both associated with car sharing companies, so they have bias, but that's not the point. I think once you put yourself out there in a public-private partnerships, you can do great things. I'm just going to leave it there. I have one more slide, but I'm going to leave it there. So that's my inspiration.
All right. Wow. So I'm gonna take some of the momentum from Margi's talk here and just ask you a simple question. So you're telling me that this $10 million sponsorship and this multimodal app that you're creating was a result of a phone call and your relentless drive to get this done?
I think, no, I think when you show that you can be a good partner and that you trust. So one thing that I didn't get to, which was going to be my wrap up, so this opens it up. As a government, don't ever expect a private company to have your interest. If you do, you're dead in the water. Their interest is to make money, right? So I'm never going to tell Strava who their user group is. But if you come to the table and say, I have an issue, you've got a means, let's meet in the middle, I'm not going to mess with your business model, I just want to partner with you, and here are the bounds in which I need to work with. Once you show that you can do that and be respectful and good relationships, other private companies say, oh, that's a government I can work with. So it's not necessarily that phone call. It's creating a legal model and an attitude about private-public partnerships. Does that make sense?
Yes, that makes sense. And I think that's important, though. It may not have been just a phone call, but I mentioned that because you made the phone call, and I think that's something that we want to encourage all of us to be confident enough in doing, which is picking up the phone if you have an idea, reaching out to someone else if you have an idea, finding those external partners that can give you information. And I was talking to SaraT before, and she said very humbly that she had worked in public health for a little while. She was the public director of health in San Mateo for over a decade. That's a pretty big deal. And what we talked about was this notion that when she was in that role, she didn't always know all of the lingo or all of the tools at her disposal. So for all of us who may not know the lingo we're supposed to know or the tools at our disposal, what's your advice for us? How do we make sure that we kind of know enough, but also are confident enough to reach out?
Yeah. I don't think there's not one way to go about it, but I would say the first is don't be afraid. Don't be afraid of the technology. Don't be afraid to say what you don't know. So I can't tell you how many of my senior managers, my leadership team when I was at San Mateo County Health Department didn't see technology as a tool in their toolbox. They had huge toolboxes. They had decades of experience in public health. They knew the research. They had connections. They were very good at their jobs. And yet technology was not something that had been expected of them, the ability to use technology as a tool to help solve their problems, right? Not necessarily the technology like, can you turn on your computer, right? But actually thinking about what kind of tools you might build to help solve your problems. And so I feel like the first hurdle is to just not, if you don't know, just ask, right? You can ask quietly in a meeting room with only a couple people, if that's the best way to learn. You can Google some of the questions that you have. You can call us at Code for America, and we can help you get there. But the first thing is to not be afraid of it. Technology doesn't have to be something that's way out there that you can't touch, right? It should be very, very accessible. So that's the first advice I would give. I think the second is get a bunch of options, right? I mean, technology it's competitive at this point. There's no reason why there should only be one answer to your question. So, I love the example that you gave. If, Strava isn't the right answer, there's got to be a company out there or a nonprofit out there or a local government out there that created something that's going to be a better fit for you. So get a few different options so you're not locked into something that doesn't quite meet your needs, that doesn't fit. And the last thing I would just recommend is, start small. Right? So often we feel like we need to solve the entire problem that we're looking at in government, and we're charged with solving big problems. But to attack that from a technology perspective is a huge investment, takes a lot of time and a lot of resources. But you can do something small, relatively low cost, see if it works, and if it doesn't, you learned something, and you're not hugely embarrassed because it didn't cost a ton of money, and you can start again. So, those are some of the things that I would say if you're in government and you're really starting to think about how technology can be a tool for you.
Great, excellent. So a question for both Jill and Stacey, because you guys both showed some really interesting examples of how to get through the lawyers, people like Margi. Margi used to be, right? And you mentioned a little bit about failing fast. So I just want to ask the question, what's the worst thing that has happened? And how'd you get through it? You're here to tell the story.
You start.
So because that's right, like all of us, if we're not supposed to be afraid, we need to know what's the worst thing that can happen.
So worst is a hard word. There's a lot of things that happen. Let's just go there. But I'm going to go with one good example. So we have a recent campaign that launched. It's a Creatures campaign. It's a Run Like Hell that Kathy talked about yesterday. And we did this great out-of-home where you walk by a mall kiosk and a creature comes at it and the glass starts to break. And how cool is that, right? And so I saw that. They said, well, why is that not breaking a mobile phone screen? Come on. Why are we wasting that? And so everyone's like, well, yeah, of course. So we turned that into a pre-roll on YouTube. Now, our YouTube pre-rolls, a lot of them are not skippable. So the next thing you know, we start to get these weird posts coming in about jump scares, and we're like, it's a couple here and there. What's going on? What are people talking about the jump scare? We're trying to figure it out. And then one of my staffers finds a Twitter blog about how to avoid the real cost jump scare with 20,000 reblogs. So this could have really blossomed into disaster. We could have had everyone on top of our heads saying, what in the world are you people doing? Didn't happen. The world didn't come crashing down on us. We did figure out that it was this ad in particular because people were teaching each other how to avoid it. And so we made it skippable. We responded to the emails. We responded to the social media posts. And everything eventually calmed down and, life went on.
Good. Excellent. You're here to tell the story.
Here to tell the story.
Excellent. Jill.
So that immunization schedule that I showed, so that was one of the things that we were actually driving people to see with the Twitter moms, now social moms, and momversation.com. And you could see there were some logos on there, the American Academy of Pediatrics, American Academy of Family Physicians. And frankly, a lot of the stuff we did in the beginning of the campaign, we stole straight from childhood immunization because they had a lot of good stuff. They had not cleared it. And we had already posted it, and it kind of, I'm not quite sure how it happened, but it escaped some of us that it actually never gone through their clearance. So here we have 68 moms that are willing to get out there and write this blog, and we have all this traffic coming to this website. And that was we had very few pieces of content back then. Really very few. And we're driving people to it, and someone says, hey, did you guys actually get that cleared? Well, I thought you did it. It was literally like one of these. And just amazing. This is really the value of partnerships is that we work with American Academy of Pediatrics and American Academy of Family Physicians all the time. And so it was one of those, it was kind of like the 4th of July thing. We called up and we were like, that great schedule that you guys did with the childhood team? Well, we did one too, and here it is, and everything looks great, right? And you already approved the other one that we send out that has the 4-point font on it, and you love that, and convinced them that they loved it, and they were like, yeah, it's cleared, it's good. So we never even had to take it down. It had already gone through 508 compliance, which is a lot of work. And so, managed to get by that one without any problem. But again, it wasn't like it was the first time we were partnering with them, and I think that that was a really small thing. You said, you can start small. That was a really small thing that we did, that little, the Twitter moms and momversation.com. But we were, the content, we had already partnered with somebody else. We had those relationships. We leveraged those relationships. And we also leveraged the person that really created those relationships, got her on the phone. That's one of those times, sometimes you have to grovel, right? So I really screwed up and I need you to help me with this. Didn't love doing that, but sometimes you have to do that, and it all turned out fine.
Good.
As far as I know, I still have my job.
Excellent. So that's the worst that can happen, people, right? Some things might miss, but if and when you find that internal or external partner, coach, ally, you can work through it. And once you find people with a common outcome, you can make it happen. So one last question for each of you. Now that you've kind of come out on the other side, in a brief sentence or so, Stacey, tell us what you wish you knew when you started that you know now. So generally I hear people say, we had no money, we had no time, we had no something, but you're down on the other side. So what do you know now that you wish you knew when you first started?
You don't have to live with a 198-day clearance process for social media.
Yeah.
There's a lot of fear of people around you who they just don't understand. They don't really get what you're trying to accomplish. And so they want to control everything, they want to see everything, and they want, if it goes through them and they see it, then it's going to be okay, right? And you can change the process. You can have the conversations and make things more streamlined and easier. Because we really did have a 198-day clearance process for 3 months of social media. There aren't 198 days in the calendar for 3 months, but we had it.
So you really became part of the solution.
Yeah, we've
That's
got
good.
it down to 27 to 30 days now.
Amazing. Good. Jill?
It was really that I hadn't embraced my inner rebel,
Okay.
which You know, I was going to come out with my sunglasses on because, these lights are bright, but I thought you guys might think those a little off. But, you know, now I'm like, I really wish I would have come out with my sunglasses on. But no, I mean, really, it was just to sort of take the bull by the horns and go for it. I mean, we really treaded lightly around a lot of things, and we started slow. And I think there were some things looking back. I mean, Amelia Burke-Garcia, who helped us through all of this, gave us this fabulous grid with all of these options. And looking back now, I'm like, take all the options. And so I think really just saying, you know, nobody else has to have done this yet. Like, we can actually be the first, which is a lot coming from the center at CDC that can't even have its own Facebook page because it's so controversial. I mean, I guarantee you that you know somebody, or you are somebody, who has some issue with vaccination. And so, I mean, we just had to get out there and say, just because we've been told, oh, you can't have your own Facebook page and you can't do this, that doesn't mean you can't be out there at all. Good. And I also learned that sometimes it's okay to beg for forgiveness later instead
Embrace the inner rebel.
Yep.
Go for it. SaraT.
You know, I wish I had known that you could actually build technology in a matter of days. I always thought that it was, you know, months or years of collecting requirements and then months or years of building something. And I'm thinking when I was in local government, had I known that I could actually build something and test it in a matter of days, I would have been a much greater resource to my community and to my employees.
Good, and that goes back to what Mark from November was talking about, agile development, right?
Exactly.
And last but not least, Margi, what do you wish that you knew when you started out?
I think being able to allow yourself to fail and fail quickly and move, just move and fail and adjust and move and fail and adjust, which I think, you know, it sounded like I was doing very quickly, but that was over the course of 3 years, right? And I could have failed and adjusted in a more compressed timeline and not got hung up on making one project work or tweaked it in a way. So kind of just don't be afraid of failure. And tech companies, they're used to that, right? They lose venture capital, they do this. It's part of their world. So you have that mindset of being willing to try things.
Excellent. Well, ladies, thank you. I applaud your efforts, and we're so honored to have you trailblazers. You guys are truly trailblazers here to share with us your stories. Thank you.